Well, the first thing to think about if you've noticed a change in your bowel habit towards constipation is why. And there are several important common reasons. One easy reason might be you've added a medication to your routine. Many medications predispose us to constipation. For example, pain medications can cause constipation. A lot of medications used to treat depression or heart disease can cause constipation. We may have been given a statin to reduce our blood cholesterol. That can cause constipation. So any change in your routine medications, think of that. Maybe that's causing your constipation. What about a change in your lifestyle? Have you suddenly become less active? That can predispose you to constipation. If the change in your bowel habit has no obvious associated cause, maybe it's a change in your diet. Constipation is very common in people that travel because their diet changes. I know several patients who take some bulk forming agents with them when they travel, just to prevent that sort of travel-related constipation. So the colon needs a certain amount of roughage to work most efficiently. And if we don't give it that amount of roughage, then the stool spends longer in the colon than it should. And the longer it spends in the colon, the more water gets sucked out of the stool, so the smaller it gets and the harder it gets. And the smaller it gets, the longer it spends in the colon. And the longer time it spends in the colon, the more water gets sucked out, and the smaller it gets, and the harder it gets. And so you can see that there is a vicious circle of abnormal colon motility due to not eating enough roughage. So increasing roughage to the amount that your colon likes is the first step in correcting small volume stool and hard stool and infrequent stool. If there's no obvious cause, then maybe there's something wrong with the colon. So if the change in your bowel habit lasts more than a day or two, then think about talking to your doctor about it.